Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
Disclosures for this podcast are listed in the podcast page.
Providing high-quality cancer care to patients is the goal for any oncologist. Yet, there are many places across the globe that face multiple hurdles in achieving that goal. One such location has limited trained personnel, financial constraints, geographical challenges, and limited access to healthcare service in rural areas. The location, the state of Sarawak, located in the eastern part of Malaysia. The population is almost evenly split between urban and rural areas, which are the most dispersed in Malaysia. The major challenge in Sarawak is the inadequate connectivity in the rural area and limited access to healthcare service. To address these issues, in 2020, a collaboration was formed between Sarawak General Hospital, University of Malaysia, Sarawak and ASCO through ASCO's International Cancer Corp program, or ICC for short. The ICC program is focused on three basic goals: incorporating a multidisciplinary approach into cancer care, integration of palliative care into oncology care, and quality improvement through ASCO's Quality Oncology Practice Initiative, or COPI program. This podcast will spotlight all the planning, activities, and results thus far of the ASCO ICC program in Malaysia. Hello, I'm Dr. Roselle de Guzman, past chair of the Asia Pacific Regional Council of ASCO. I am pleased to spotlight one of ASCO's collaborations with a lower resource country to improve the quality of cancer care through a multifaceted approach. This year, we are focusing on Malaysia, where through the ICC program, ASCO has been providing training in multidisciplinary care, palliative care, and quality measurement. Joining us later in the podcast will be medical oncologist Dr. PJ Voon, who serves as the onsite coordinator for the ICC program at Sarawak. First, we will speak to an ASCO volunteer of the ICC Malaysia Program, a medical oncologist focused on neuro-oncology, Dr. Evangelia Razis from Athens, Greece. Welcome, Dr. Razis.
Thank you. Thank you for the opportunity.
First of all, Dr. Razis, what made you want to volunteer for the ICC Malaysia Program, and what has been the most rewarding aspect of this service for you?
So I've been actually collaborating with ICC for many years through ASCO and other programs as well, such as the Honduras. And I find volunteering an extremely rewarding experience because you share and interact with colleagues from all over the world. You offer to those less fortunate, and you actually learn a lot through this process as well. So volunteering is a very rewarding process for me, and I've been involved in it for many years. Plus, the opportunity to do something in neuro-oncology, which is very close to my heart, is very important because this is a new field. I feel it needs to be exposed in all countries because it has many intricacies.
Well, that's truly rewarding and must be really a fulfilling work for you, Dr. Razis. Dr. Razis, you also serve as a lead facilitator of the Project ECHO Neuro-Oncology Mock Tumor Board Series, which delivers monthly online training to physicians from Malaysia. Can you tell us more about this project? What are mock tumor boards?
So Project ECHO, the word stands for Extension of Community Healthcare Outcomes, and it's a project that has attempted to be near community healthcare delivered in low and middle income countries through virtual media to support the healthcare in these areas. And in this particular effort, we are holding Neuro-Oncology Tumor Board once a month since September with the Malaysia team. It's mock because we don't actually deliver specific patient advice for the purpose of patient care. We actually do it for educational purposes. So we present cases and then discuss a topic. The program has been set up for the several months now by the Malaysia team based on their needs, which neuro-oncology topics they want to highlight. And we have a once a month, 1.5 hour session whereby cases are presented and then an invited speaker from several places around the world, as I'll tell you in a minute, highlights this topic and then discusses the cases and discusses the questions that the group from Malaysia has. And not only have we been able to be joined very regularly by the Sarawak team, but other parts of Malaysia have joined in, other centers in Malaysia have joined in different occasions. Now, the speakers have been experts from Europe and the United States based on their expertise in the particular neuro-oncology topics.
So Project ECHO is one of those innovative way of delivering healthcare to extraordinarily challenging environments, those which are extremely remote or under-resourced areas. So to your knowledge, Dr. Razis, what improvements have been made since the implementation of Project ECHO?
Over the last 9 months, I have noticed more insightful questions that show that some understanding of standard neuro-oncology way of thinking, if you will, has come through to the colleagues that are joining us. Though I must say that they were very knowledgeable from the beginning. I also hope that certain intricacies of neuro-oncology, such as, for example, the way to read scans and evaluate the fact that there may be pseudo progression or pseudo response, the way to integrate molecular parameters into the decision making process has now become part of the way they think about patients. And ultimately, the most important aspect has been the multidisciplinary approach to neuro-oncology and the constant use of all specialties to make a decision: surgery, radiotherapy, radiology, pathology. All of these specialists need to come together to produce an appropriate decision for the patient.
So one thing that's interesting as well is in 2013, Dr. Razis, your institution, Hygeia Hospital in Athens, Greece, was one of the first outside the United States to join the Quality Oncology Practice Initiative or COPI program of ASCO. And your program was also the one to be accredited. So Sarawak General Hospital in Malaysia is collaborating with ASCO as well for the COPI program that focuses on quality improvement. So based on your experience, what benefits does the COPI program bring to an institution?
So COPI, in fact, is an extremely useful way to streamline one's work and increase patient safety and patient satisfaction. I would also say that it helps reduce waste of resources, which is particularly important in resource limited settings. And we do have a COPI version that is, for limited resource settings. It's amazing, but just doing one's work lege artis does result not only in better outcomes, but less waste. And that I think is extremely important for Sarawak. So I think they will find it very useful to be streamlining their work through COPI.
Thank you, Dr. Razis, for sharing your experience, your expertise, and your insights. Now, at this point, I would also like to introduce medical oncologist Dr. PJ Voon, who serves as the on-site coordinator for the ICC program at Sarawak. Dr. Voon, welcome.
Thank you so much.
Dr. Voon, can you describe what cancer care was like in this area of Malaysia for the past few years, and what are the main challenges in providing quality cancer care?
Yes, of course. So first of all, I would like to actually give a brief introduction of Sarawak, which is actually situated at the Borneo Island of Malaysia. And we are the largest state in Malaysia with a very large land area populated by only 2.9 million population, meaning it's actually very sparsely populated. And for your information, newly diagnosed cancer cases in our state is about 2,300 cases a year. And the common cancer include breast cancer, followed by colorectal and lung cancer, as well as a cancer that's peculiar to our setting here, that is the nasopharyngeal cancer. And half of our 2.9 million population, as mentioned before, are residing actually outside the urban area. And that actually causes the issue of accessibility of healthcare, in particularly the good cancer care for this rural population. there has been always a great challenge. As we have only one public comprehensive cancer center covering the whole state, and thus inequity of access of cancer care is one of the major hurdles actually in providing a good quality cancer care in our state here. So in addition, inadequates formally trained, for example, oncologists and palliative care physicians, as well as other allied healthcare personnel like oncology nurses, palliative care nurses, has also negatively impacting on the quality of care that we are providing here. Furthermore, limited availability of good and top-notch cancer infrastructures, especially at the district hospital outside our capital city of Kuching, also possesses a great challenge to us in developing a good quality cancer care across the whole state. Moreover, similar to many parts of the world, the ever increasing cost of cancer treatment, especially on the expensive new anti-cancer drugs, is another pressing issue for us as well. In summary, I would say that inequity of access due to the geographical barrier, lack of human resources, inadequate infrastructure, and also the ever increasing cost of cancer care are the major challenges that we are facing here in Sarawak.
Thank you, Dr. Voon. I'm sure the situation in Sarawak resonates with other countries, low and middle income countries. Of course, there are truly challenges, but of course, with the challenges come opportunities. So, what benefits or changes have taken place through this collaborative ICC program?
I have to say that participating in ASCO ICC program is one of the greatest things that has happened to our radiotherapy, oncology, and palliative care department, Sarawak General Hospital. We have gained tremendously, definitely for that. And for instance, we have been actively participating in a highly personalized, I want to highlight the words, is the highly personalized palliative care education program, which is one of the highlights of this collaboration. Various projects have been successfully conducted, including the ASCO Palliative Care e-course, which subsequently led to the Train the Trainers program. This program benefited not only Sarawak team, but also palliative care provider across Malaysia as well. And this aspect of human development in palliative care was further consolidated with the in-person training by Dr. Frank Ferris as well as Dr. Shannon Moore in November last year when they came to visit us physically. We are very grateful for that. And in addition of enhancing palliative care, another very interesting project that is actively ongoing is the Project ECHO Neuro-Oncology Tumor Board Series, which deliver online monthly training to physicians across Malaysia on neuro-oncology care. It has been discussed by Dr. Razis earlier on in the podcast. That's why I'm not going to elaborate at length here, but essentially, the idea of this project was conceived initially in view of the gap that we noted in our neuro-oncology management in our hospital as compared to those common cancer that we are actually treating. So through the didactic lectures and many case discussions of the recent, in-person visit by our ASCO volunteer, Dr. Kevin Chua, and management of our neuro-oncology cases definitely has been enhanced. And we are looking forward for the Razis to actually come to visit us physically as well. At the same time, we are also looking forward for the incoming multidisciplinary board projects under the ASCO ICC program on breast cancer management in August this year. I believe that Dr. Guzman is going to come to visit us as well. We're looking very much forward for this as well. And at the same time, this exciting project is under, active planning phase now. And furthermore, we are also eagerly awaiting the improvement of quality cancer care program using evidence-based quality measures via Corp project in the near future.
Dr. Voon, it seems there's a lot of things happening with Sarawak General Hospital, and we know that there are so many patients globally that do not get the comforts and benefits of palliative care program. You have mentioned palliative care program. Has the ICC Sarawak program made a difference in patient quality of life thus far?
Again, the answer is yes, a definite yes. Okay, so ASCO ICC Sarawak Palliative Care Program has definitely made a great and difference in the patient quality of life. This collaborative works between Sarawak General Hospital, our university, UNIMAS, And ASCO has been in its third year, and many important palliative care milestones in Sarawak has been accomplished actually. And this specially designed program, again, I would say that this is a special design program that fit us, that fit our needs. Has been mentioned before, include the ASCO PFE course, trainer program, the mentorship program through the IDEA PCR Awards from the Conquer Cancer Foundation, and last but not least, is a translation of the ASCO Creative Care interdisciplinary curriculum resources to our national language to reduce the language barrier in training and education for our people here. And all these innovative programs have provided a fundamental framework of palliative care education that is invariable in equipping our oncologists as well as oncology trainees with necessary knowledge and skill set to better identify and also meet the palliative care needs amongst our patients. Also, ensure a more competent and timely, I think the word is timely, palliative care provision at a general level by oncology team of our hospital. I think that is extremely important. Enables the team to incorporate basic palliative care management early in the course of the disease. We call this as early introduction to palliative care in our hospital. And in summary itself, actually, the ESCO collaboration has enhanced the teamwork and helped the oncology team to recognize our own limitation while providing the general palliative care, thereby encouraging, again, the word is the timely palliative care referral whenever appropriate to ensure that patients with more complex physical, psychosocial, as well as the spiritual needs have the necessary input and support from our palliative care team throughout the course of the illnesses.
So we have been discussing important points on the ICC program, focusing on multidisciplinary cancer care management, palliative care program, and the COPI program. What do you think are other solutions? Are there others that exist to overcome hurdles to provide quality cancer care to people in Malaysia? Dr. Voon?
Yes, definitely. Yeah, yes as well. There are many definite yes in our conversation. So besides the ESCO ICC program, various existing and some project list which is in planning now to overcome hurdles to provide quality care to the people in Sarawak. I mean, has been implemented or currently in very active planning phase. So in terms of inequity access to good cancer care due to the geographical barrier, we actually aim for decentralization efforts of cancer care here in Sarawak. One of the actually efforts or one of the initiatives is to post our senior longer term oncology liaison medical officer with adequate oncology experience to other district hospitals in Sarawak so that a better cancer care could be delivered to the patient closer to their home. This was also consolidated with our regular visiting oncologists to these district hospitals. As part of decentralization efforts as well, there is also a nursing training program for systemic treatment administration being conducted since last year in all major district hospitals with the aim of credentialing all our nurses in the state managing cancer care patients with this essential nursing skill of administering systemic therapy in their own hospital. In addition to that, weekly oncology and palliative care continuous medical education program across the state has been conducted since the fourth quarter of last year. And this would disseminate oncology knowledge rapidly to the healthcare provider, especially those outside our capital city who has inadequate exposure in oncology care. And upgrading of our cancer care infrastructure has also been actively planned. And we are actually looking forward a new comprehensive cancer center in our capital city, I think in the next few years. And besides that as well, our center is also robustly developing our clinical trials capacity in hope that we can provide additional treatment options to our patients who have limited option of treatment due to cost constraint. And in summary, I can say that various initiatives have been implemented to enhance the cancer care in Sarawak. And one thing for sure is ASCO ICC program has been facilitating all these positive development.
So many things are happening, so many things are being done, and with all your efforts and knowledge and expertise, of course, Nothing is impossible, and it's always helpful if you have a very dedicated and committed team, right?
Yeah, definitely. We have a very dedicated team, that's for sure.
So, Dr. Voon, thank you for being with us today and for your on-site coordination of the program. And Dr. Evangelia Razis, thank you for volunteering your time and insights to the ICC program and to our podcast. Malaysia is not the only location that the ICC program has been implemented in. There are currently 9 sites in Asia, Africa, and South America currently accepting volunteers. Now, I would like to give a brief information for volunteers wanting to participate. ASCO pairs eligible oncology professionals with a medical center whose needs match the expertise of the volunteer. Volunteers must be appropriately trained and credentialed medical professionals who specialize in oncology. This includes physicians specializing in medical, radiation, and surgical oncology, laboratory professionals, and nurses. Final year oncology fellows may also participate if paired with an experienced volunteer. Volunteers spend 1 to 4 weeks on site. During that time, they teach and train staff, residents, and students and gain insight into cancer management needs and challenges at that institution. As an added benefit, the program enables volunteers to form long-term supportive relationships with clinicians in participating countries. If you are interested in volunteering for the ASCO ICC program, please go to volunteer.asco.org. That's volunteer.asco.org to apply. I'm Dr. Roselle de Guzman, past chair of Asia Pacific Regional Council of ASCO. Thank you for listening to this ASCO Educational Podcast. The ASCO Education Podcast is where we explore topics ranging from implementing new cancer treatments and improving patient care to oncology well-being and professional development. If you have an idea for a topic or guest you would like to see on the show, please email us at education@asco.org. To stay up to date with the latest episodes and explore other educational content, visit education.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.